Okay, it is now 7 o'clock. Good evening, everyone, and thank you very much for taking time out this evening to learn about one of our new IPHA partners, XRX. And we're pleased to have Al Branca here with us this evening to be able to explain a little bit more about this new partnership and how it can be what I'll say, a win-win-win instead of just a win-win, because this is something that can benefit not only yourselves as the pharmacy, but the association, and most importantly, your patients. So I'll turn this over to Al.
Thanks, Garth, and much appreciated. And thank you, everyone, for allowing me to enter your store or your living room or your mobile phone tonight. Not sure where you're tuning in from, but listen, I'm not a pharmacist, nor do I play one on TV, but I get it. I work with independents each day, and I understand the trials and tribulations and the road to hoe that most pharmacies have to travel on a daily basis. So I certainly appreciate the time allotted me tonight. I'll try to be brief, but hopefully informative as well. So my name is Al Branca. I'm president of XRX. We're known as a pharmacy benefit administration organization. What does that mean? Well, basically, we're a marketing and technology company in the pharmacy space. We've been around for about 30 years. Back in the 90s, my co-founder and partner created one of the first cash card programs born out of need before Medicare Part D. From one of the first transparent processors. SunRx, pretty big in the 340B space today, but they came around really to address the non-transparency of PBMs. They work with a lot of self-insured groups. And so he started that company way back in the 90s. And today, where we're at is we own and manage several programs that are known as discount programs, but they're nothing like any kind of product that funnels back to a PBM. We actually consider ourselves an anti-PBM. We're David in the land of Goliaths, and we're in this space to disrupt their model whenever we can. We've always been extremely cognizant of the challenge that independent pharmacies face. And it's really, they get hit from every end. I understand it. There's constant financial pressure. I like to call it abuse from PBMs. And some of the other common challenges that most independents share is, the issue of trying to compete with large national chain and box stores who have very deep pockets and spend lots of money marketing, trying to convince the general public they've got the best thing out there. I myself am a victim of ignorance. Before I was in this space, I used to assume that, the CVSs and the Walgreens of the world are going to have the best pricing because they're bigger and they got more buying power. But I found out through this business that nothing's further than the truth. And let's not even talk about service. The challenge, how to market that word and get it out there in the community to drive traffic to your doors. The other reason we decided to create this vertical and help independents is one of the largest players in the discount space. We actually gave them their start, created their first platform, and they've become pretty much unmanageable and are a thorn in everyone's side, causing disruption. And I don't need to say the name. So about a year and a half ago, we created this new vertical. And today, a big part of our focus is working closely with independent pharmacies, creating no-cost loyalty programs. What we do for them is we create a white labeled website, not to replace their corporate site. This one has accurate pricing technology that drives traffic to them as opposed to chains. We give them custom flyers, 1,000 branded cards, other marketing collateral, and we work with the pharmacy on how to utilize the program internally for compliance, medication adherence and retention, as well as to swap out the not so pharmacy friendly coupons. But most importantly, how to use the program effectively as a marketing tool throughout the community. Just over a year into this, we have approaching 1,000 pharmacies already under our belt. Because hopefully you'll agree, once you see this brief presentation, there's really no downside. So I just want to walk through this deck quickly and give you a better feel for it. And at the end, I will field any questions. So, and a lot of times the questions I receive are what I typically would go over. So I would ask to hold that and I'll do a Q&A at the end. So obviously, as long as there's costs associated with medication, there'll always be a problem with non-adherence. Our program really does one thing. It addresses cost, but it does so in a very pharmacy-friendly fashion as compared to our competitors. We had a lot of fuel added to our fire with the bill signed into law that I'm sure you're very familiar with, Patient Right to Know and Know the Lowest Price Acts. Well, most pharmacy owners tell me, at least on the down low, they've always told patients about lower cost alternatives. And now everyone can do so without looking over their shoulder because those gag clauses are eliminated from PBM contracts. And that works well for us because quite often our negotiated price will be lower than a generic insurance copay. And when it is, the only one losing that game is the PBM because the claim never happens. Inherently, the problem with discount programs is who they funnel back to. PBMs pretty much act as badly in the discount space as they do the insurance world, between the spread games, clawbacks, hidden rebates. Those programs are also, by design, meant to be ineffective if you have insurance because they don't want to cannibalize their core business where they make the majority of their revenue. We're actually in the space to disrupt PBMs when we can, bring transparency, and take them out of the equation whenever possible. Our model is a whole lot more pharmacy and patient friendly. Our model is pharmacy and patient friendly for multiple reasons, but one is we don't play spread. Two, our negotiated price is always what the pharmacy is left whole with. And if we're the lowest cost option, and only with the lowest cost option, we add a flat, modest admin fee. And we actually share that with independent pharmacies that are part of our loyalty program. Since we're not a PBM, we provide a benefit to more than just uninsured patients. If a patient has a generic copay over $10, it's worth checking our price because more times than not, we're going to beat the insurance copay. And when we do, the only one losing is the PBM because the claim never happens. Patient saves, pharmacy builds loyalty for the same reason. We get a little piece of business. We do a revenue share back to our pharmacy partner. But the best part of all that, when we beat the insurance copay, the pharmacy actually nets more revenue, even though they're collecting less than copay. And that's because in a typical funded environment, when Optum, Express Scripts, or Caremark tells you to collect a $20 copay, well, that's certainly not the end of the game because on the very next claim they process, they will net out or claw back a large portion of that. Our model is not built that way. That's why we're the only discount program that's been vetted, endorsed by, and a corporate member of NCPA. We really have a singular function, and that's to simply ensure the patient always gets the better deal. Whether it's their insurance copay, the pharmacy cash price, or our discounted price, the patient always pays the lesser of, so there's never a disadvantage. The other huge difference in our model is, unlike our competitors, we have no agenda to collect any personal health information and sell PHI off to big pharma and high bidders. Our program is completely anonymous. We require no personal information to access the program, nor do we track or collect any PHI in our daily report. So it simply means that patients' identities are protected and anyone can use the same card. Our program has an open formulary. It'll work on any FDA-approved medication, brand, generic, even OTC if it has a physician script. And unlike a lot of those one-time use coupons, our program never expires. We have a huge pharmacy network. Not that all pricing is equal, which you'll see in a second, but 67,000 pharmacies nationwide, pretty much everyone, most chains, box stores, supermarkets, and most independents as well, contracted through their PSAO. One more quick point to how pharmacy friendly we are. We're the only program a few years back that survived a complete nationwide purge at Walmart when they deleted every customer profile of discount programs in an effort to flush out some of those not so pharmacy friendly players. Our program tends to be sticky. We have a high rate of conversion, meaning that when people use it, they save. And the reasons are just simple. It's fair pricing and modest flat admin fees keep the cost down, so it converts more. But we give consumers multiple ways to find the lowest price. We offer a 24/7 multilingual customer service helpline where our agents can price people's medications and let them know where the best local cost options are, or to use our award-winning pricing technology, which I will demo for you in just a second. Every one of our partners also has access to our technology and transparency. Each morning, we upload to a portal all the transactions from the previous day. So based on the cards that are used with a unique group number that tracks back to that pharmacy partner, regardless of where that prescription gets filled, our partner can actually see the transaction detail, everything minus PHI. And regardless of where, they would still earn that additional $2 admin fee back from us. Pet med business, it's a huge opportunity, and a lot of pharmacies don't take advantage of that. But what we do is create a couple of marketing flyers for our pharmacy partner. One is really meant to help educate and approach local veterinarian practices. We know often vets write scripts they can't fill. Now, compounding is only one reason, but also many times it's a human equivalent medication they just don't carry because of a limited formulary. Also, If it's a maintenance medication, they realize the patient's owner is not coming back every month to get that filled. So the program that we have is really about driving new foot traffic. So having the program available and partnering with local vets can get someone in the store for the first time. And it's not really as much for, that one-time cephalexin fill for Snoopy as it would be their owner. Having that person come in, experience the customized or personalized service, quick turnaround and great pricing, that's the shot at a customer for life. We also create another flyer meant to educate prospective patients. It lets them know, and by the way, it would have your brand on it with your card. It has information about the store, as well as the program, how it may save them a few dollars and help them better afford their meds. Something like this would be perfectly positioned at any point of care provider office, whether it be a physician practice, urgent care, clinic, or even health system, because obviously you can't get any closer to point of sale than point of care. Somebody leaves there, they've got scripts to fill now. One of our large competitors knows that. They're going to spend millions carpet bombing the world. But another flyer we provide really is a consumer reports reprint that spells out how this large competitor, that's in 9 out of 10 doctors' offices, shares personal health information with Facebook, Google, and other internet marketing companies. And now they're in the telemedicine business, so they're an actual competitor. So it just makes it easy for our pharmacy partners to swap those cards out with theirs. We also create a white labeled site. This has nothing to do with your corporate site. This would be an addition to, and we help you link it back. But this site is mobile optimized. It's reader friendly on any size screen, from a smartphone up to a desktop. We make it available in multiple languages, including professionally translated Spanish. We have explainer videos in plain terms on how the program works. But the primary reason people would come here is to find the lowest price. So I'm going to type in Garth's zip code here, 2704. Make sure I got that location in there. There we go. If I was on a mobile device, it would just divert to GPS or current coordinates. Now, the cool part about our tool, other than the fact it's real accurate pricing and it's updated daily, if I know my insurance copay, I can put it in. Most people don't. I take meds every day. I know I've got a $20 generic copay. So I type in 2 medications each morning. Now, this is not just for consumers. It's also the ability for our pharmacy partners to do price checks quickly on the fly without having to incur switch fees. It always defaults to the most commonly prescribed form, dose, and quantity. I actually take 30 milligrams of lisinopril, so I'll change that and save it. I take another medication, Lipitor or atorvastatin. I do take 40 milligram tabs. I get a 60-day supply. So I've got both medications saved to the list. I click continue, and our APIs will instantly price up all the local pharmacies and sort from lowest to highest price. Don't let the $40 fool you. That's my insurance copay. Most independents are going to be right at the top, and they're grouped in to start with the local pharmacies. As part of the loyalty program, we would break them out and give them first level visibility, and their pricing is going to be more competitive than pretty much anyone else. When I select that, it shows the current negotiated price with their PSAO. And if I've got a $20 copay, then I'm not using my insurance because I'm saving in both cases. Instead of $40 in insurance copays, I pay $28.88. I save over $11. The pharmacy gets to kill 3 birds with 1 stone. 1, save the patient money, did him a solid, built loyalty. 2, eliminated the insurance claim. They kicked the PBM to the curb and any future threats of clawbacks, not to mention DIR. 3, by charging the lesser amount, they actually net more revenue because once again, there's no giant clawback on the very next claim. If I take out my benefits, click no and continue, you'll see how our pricing tool is designed to drive traffic to independent pharmacies, not the supermarkets, not the chains, and certainly not the box stores. We don't advertise Walmart's $4 and $10 generic. We show with this program their AWP discount price, which is pretty paltry. So if a patient were to get one of the cards we provide, and by the way, we provide 1,000 branded cards at no cost with a logo and a unique group number that tracks back to the pharmacy partner. But if someone were to get this card, go to the website address and use the pricing tool, they'll be driven to an independent and not a chain or box. Also, people can get cards digitally off the website. They can text, email, save to their smartphone, or print unlimited cards. So about a year plus into this, approaching 1,000 independents already signed, because the only obstacle, quite honestly, is human nature. When things sound too good to be true, they normally are. But the beauty of our program is the fact that there is no downside. There is no cost to the pharmacy, and there's no mandate. We would do a best practice or launch call to discuss distribution, touch points, how to effectively use the program in the community as a marketing tool. But it really comes down to the independent partner, how they want to implement and utilize the program. So in summary, folks, this platform gives independents access to a no-cost loyalty program and the ability, quite honestly, to compete with all the large chain stores who have in-store programs. It offers lower cost alternatives to help with patient retention, the ability also to swap out those not so pharmacy friendly coupons at point of sale and give that patient a couple cards to walk away with. The pricing tool will always drive traffic to independents, never to chain or box. You may have noticed with some of that pricing, very competitive 90+ day fills, which can counter and help retain patients and not lose them to mail order. Unlike a lot of the programs, which puts pharmacies in the red, ours is extremely pharmacy friendly, ensuring a fair profit with every claim. And the best part, no matter where your card winds up, your store or across the country at another store, wherever used, because of that unique group number, that pharmacy still earns an additional $2 admin fee per claim. Lastly, the program strengthens patient and pharmacy compliance. Patient side helps with adherence. Regarding the pharmacy, well, by partnering with us, that alleviates the need for any pharmacy to have to lower their cash or UNC price and be in conflict or breach of contract with PBM agreements. By using our program, that keeps the pharmacy partner at arm's length and compliant because they're using our bin and our contracted rate and not touching their UNC. Last point I wanted to make is that we hear back from pharmacy partners, they like the idea now of not having to figure out on a daily basis what is a fair cash price, what's competitive in the marketplace based on drug costs, conditions, competition, what's good for the patient, what's still a good margin for the pharmacy. Our program pretty much does that on autopilot because it's updated each day. So that really concludes the presentation. I know that was a whole lot to swallow in a very brief time, and I talked kind of fast because I'm from Jersey, so I apologize. But in any event, Garth, if there's any questions, I'd be more than happy to address them.
Thank you, Al. Does anyone have any questions? You can put your, excuse me, in the chat or in the Q&A function, or if you want to hit raise your hand, I'll go ahead and unmute your line. And Rob, I see you have your hand up, so let me hit the button here. Just 1 second. Rob, you should be, your line should be open.
Okay, great. I just had a question. I was on /RX and I just brought up a prescription for a Tenolol, and it quoted $751 for 30 tablets. So we obviously collect the $751 at point of sale when it adjudicates.
Yep.
And then what comes back? I mean, so the $751 is our entire, that's the entire amount we get, or is there on the back?
Yeah, let me, I'll spell it out and use even numbers so it makes sense. So if there's an admin fee that's added over and above the negotiated rate. So based on the PSAO agreement, if the negotiated price, let's just call it $12 to make it even in simple math. If that were the negotiated price, then what the patient would pay and what would adjudicate at, it would adjudicate at $1,650. So there's $450 switch, processing, and admin. You get the 12, which was the negotiated rate. Your PSAO does a reconciliation, they pass $450, but we turn around and hand you $2 of that back. So the net of that is you would pretty much negate from whatever that published price is, $250. You'd also make the $2 if someone were to take your card into a chain or a box store and use it anywhere else. You would, by that unique group number, that would still get you that $2 admin fee, regardless of where you use. So let's say I go to a local urgent care and I see your card in the waiting room, I pick it up, and I'm a creature of habit, I'm going to Walgreens. I can use that there based on that unique group number that would track back to you, and you'd receive the $2.
Well, let's just use that 751.
Yeah, sure. So you're netting about on that, you're netting about $5.
Okay, so 751, it'd be 751 minus 450 and then $2 back.
Yeah, so the net way to think of it is just subtract 250 from whatever price you see.
Okay, so you subtract 250.
And that pricing tool is going to be extremely accurate, accurate. Okay. That's updated every day.
Okay, so the 750, so then in this case, the Tenolol, we would collect 751 from the patient at the point of sale when it adjudicates, and then you would basically take 250 back on the back end. I mean, as a net. I mean, you would take 450 back and then give us $2, and how does that?
Sure,
you take the 450 back like on the EOB, and then when do we get the $2 back? I guess I don't understand why
Yeah,
you're doing.
we pay pharmacy partners monthly and via direct deposit typically. So you get paid every 30 days. $2 times the amount of claims that were adjudicated.
Okay, so in this example, we would pay you $450. You would send us a bill for $450 for that claim, and then once a month we would get $2 back on each claim that we pay.
That's correct. And the reconciliation is typically done at the PSAO level, so you get a remit at the end of the month rather than a bill.
Okay.
But yes, that's basically the way it works.
Okay.
That's correct.
Thank you, Rob. Really good questions. Let's see, Al, we have a couple of questions here in the chat. First one, I'll get to Rupesh. Yes, some of you I do realize are listening in the car or on your phone. We will make the video and the recording available to everyone so you can review the presentation again. Barbara's got a good question here, Al. Why do you ignore the $4 price list from various pharmacies when you're looking at prices online for comparison? She says, seems inaccurate and slanted towards your card.
Well, we actually don't show the UNC price. We show the negotiated price, whatever the discount price is. Now, if somebody walked into Walmart with our card, they would, and it's on the $4 list, they would pay $4. We don't quote it on the pricing tool because our pricing tool by contract, we have to show the negotiated price, which is different than the pharmacy UNC. So if it's on their $4 list, we don't know that. And by contract, we don't show it. We show the negotiated price. But that's a really, really good question. But if that customer showed up with our card at Walmart and it's on the $4 list, they pay the lesser of. They would pay $4 at point of sale because no one pays more than the cash price when it processes.
Thank you. Any other questions or comments? I guess the only thing I will add in here just for complete transparency is that part of that fee, as I said, this was a win-win-win. Part of that does go back to help support the association. So this is where you do know where all the money is going. You get part of that back, and also the association gets part of that admin fee as well, and that does help continue to support the mission and functions of the association.
And that does not come out of the $2 that the pharmacy still gets that whole $2. We pay the association an additional 50 cents out of that $2.50. That's correct.
That's correct. And I just kind of want to go through some of the history of this. This is a project that IPHA and IPME, which runs our oversees our community network and other special projects. We've been trying to find some type of discount card solution because of all the other products that are out there that basically charge you to discount your price. This way, it is beneficial for all parties. And I think in a way actually goes above and beyond a lot of the other products that are out there, and in providing a useful tool for patients, because especially you look at it for when they travel, that they may not always have access to you, and that way they can also have access to the best price around. But we looked long and hard. We're really glad that we encountered Al and his team at NCPA last fall, and were willing to work with us. I think we're the second state that AXRX has been working with in this fashion, and we're really glad to partner with Al and see how we can help pharmacies. I guess Al, what I would ask here, and you may be ready to prime up for this, is if one of our pharmacies on here tonight wants to sign up and take the next step, what do they need to do?
Yeah, so I just put my contact info here. We have this toll-free actually rings right to my mobile and my desk phone. There's actually at this site right here, axrx.com/PPP, which is pharmacy partner platform. That will take you to a page where you can actually click on my calendar and set up a web demo if you'd like, or fill out a request for contact form and I'll reach out, usually same day. And then the process is pretty streamlined. I just wanted to add, you mentioned, and I forgot to mention this, Garth, you talk about other players out there, discount cards, and there's two big ones coming up the pike that aren't even here yet. If you think our friends at where are problematic, but Amazon and Walmart are now fierce competitors because Walmart's recently entered the subscription-based model, right? So they're going to be trying to monetize, as well as Amazon, all their clients. So Amazon just signed a deal with Inside RX, basically Express Scripts, to be pushing that card on everybody that has buys from them and gets things delivered. And Walmart just inked a deal with MedImpact, going to do the same thing. So those cards are going to be, hitting the airways very soon and pushed very heavily. So this is an opportunity for pharmacies to get out in front of all that noise and have your own in-house card. The best part about our program, there's no spread. There's no surprises at the end of the day. It's not a variable fee. There's no here's $6 off one, here's $20 off other, with like a lot of those variable programs work. So it's a way for a pharmacy to have their own in-house program and basically call it their own and be branded. But to answer your question, this toll-free number and this website, they can either fill out a request form to be contacted or set up a quick demo.
Any other questions? All right. Well, we definitely thank you for your time tonight. And Al, I really appreciate you taking time out of your busy schedule to help inform our members on this new benefit. And I'm sure they'll be contacting you if they have any further questions.
Thanks, Garth. Appreciate the time and appreciate everyone joining tonight. Have a great night.
Thank you. Good night, everyone.